Welcome to the online clinical Cantonese lesson. 臨床廣府話 provided by Family Care Physiotherapy Clinic. Today we'll go through about the instruction of taking drugs, how to tell your patient to take the drugs that prescribed by doctors. Usually it is not a duty of physiotherapy, but just for teach Cantonese only. Instruction for taking drugs is critically important for elderly particularly. So this lesson will be useful for doctors and nurses. Those are the most common drugs, at least in my clinic, then relate to musculoskeletal pain, then we will use more. Those are the very basic common drugs only. Anti-inflammatory, we call it 消炎藥. Okay, as you remember, the inflammation Cantonese we call it 發炎. So you can hear that quite similar, right? In Hong Kong, we call the pain relief drugs as painkiller, right? I study healthcare at the very early time. Also, we call painkiller. Nowadays, we call it pain relief. Either one, we call it in Cantonese is 止痛藥. Okay. After you hear these two terms, you know then the medication in Cantonese is called 藥. That's why every time, no matter which medication, most common, I just said most of the case that we add the, for example, whatsoever 藥 at the end, okay? The other type is antibiotics. We call it 抗生素. Okay, 3 vowels, 抗生素. And cough serum, we call it in Cantonese cough medication, but in fluid type. We call it 咳藥水, cough syrup. And one more type is that usually is served with some strong anti-inflammatory or strong pain relief. Is the drugs to protect the stomach. Then in usual practice, there are two types. One is called antacids, and the other type is gastric medicine. But in Cantonese, we call it one term in common. We call it 胃藥. If I need to do a hardcore translate, it means stomach medicine, but it stands for the medicine to protect your stomach. 胃藥. Those are the common drugs. If you give the instruction well, these are some basic phrases you need to practice. For example, numbers. Numbers are the most important. Cantonese number 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No matter which language you learn, the numbers are the most basic and most important because you need to give the dosage. So remember the numbers well. And then the other common terms is before or after meal, or before or after food. We say in Cantonese is simple is 飯前,飯後, means before meal or after meal. Because if you know some Cantonese, you know eating meals is called 食飯. So we call it 飯前 before meal, 飯後 after meal. The other instruction is very important. Sometimes you need to give a warning. Some medication will make people drowsy. Then drowsiness in Cantonese we say some such as sleepiness. We call it 睡意, or in more layman term we call it 眼瞓. Here we come to practice how to give instructions. I give 2 examples. Let me make up an example. Assume we are prescribing cough syrup 1 day 3 times, every time 1 spoon. In our side and in Hong Kong, the measurement is prescribed as a standard spoon, a plastic standard spoon for measurement. And this after meal and cause drowsiness, no driving. So I say in Cantonese is that 呢支係咳藥水，一日3次，每次飲1斤，飯後飲，會眼瞓，食藥後唔好開車。Those are the instructions. Feel free to repeat and practice this. It's not easy because few terms together. Okay. So after you practice this, then we go to example 2. Okay. Example 2 is that we prescribe a painkiller anti-inflammatory. So it's a combine both painkiller and anti-inflammatory. And 1 day 2 times, each time 2 tablets. Okay, and for after food, then we say in Cantonese that 呢隻係消炎止痛藥，一日食2次，每次2粒，飯後食。Okay, those are the instructions. When you hand over, give the medication to the elderly. That's how we say in Cantonese to let them understand. I'm not an expert in medication, but when we know that when we give medications to our patient or clients or elderly, we need to explain what types of drugs, how much they take, how many times a day, and how many pieces, how many tablets, or the volume. We also need to give the warnings to the patient, not only for patient safety, because overdose or underdose are quite impactful, quite critically important to them, and also for our own liability. Make sure we need to let them understand. I need to give a special acknowledgement for my classmate and colleagues, Miss Heidi Zhang, who provide the professional advice for this lesson. When making this video, it is literally Christmas in 2022. I wish you Merry Christmas and a Happy New Year 2023. Thank you for attending the lesson. Merry Christmas.